All right. Hi, we are here with Emily today and we're welcoming her to the Rule Breakers studio. I'm so excited to chat with you and hear more about you, your journey, and all the things that you have to offer. So, Emily, with that, I will hand it over to you. If you'll just tell us a little bit about your background and then we'll jump into this conversation.
Thanks so much. I'm really excited to be here. My name is Emily Will. I'm a clinical strategy director at DexCare, nurse by background, and have been a nurse for almost 20 years, working the majority of my career in ambulatory orthopedics. And for the last 2 years, have joined a healthcare startup, DexCare, and really am passionate about nursing innovation, helping to think differently about the care team and how we deliver care in this country. How do we make it better, and how do we make it easier to access care?
Yeah, that's a big jump to go from ambulatory ortho straight into startup world. So how did that's a massive jump. How did that happen?
It is a massive jump. And, I would say that I've always been the innovative nurse, the nurse that was always tapped to lead a project, try something new. Remember the first day that we were live on Epic and being kind of the super user and then the ambulatory expert. And then as Canto and some of those other functionalities came out, actually bought my own iPad so that I could utilize those tools within my clinical practice as an orthopedic oncology nurse. And then as I shifted into nursing leadership and ambulatory orthopedics, really began to take on some of the newer innovative work for our health system. Was really instrumental in getting our orthopedic urgent care off the ground, and it really focused on brick and mortar and having that kind of walk-in care access. About 2 years into our operations as an orthopedic urgent care, we knew we needed to do something to differentiate ourselves in the market in the Milwaukee area. And so our innovation arm, at the time I was at Freighter in the Medical College of Wisconsin, partnered with a startup out of the Providence Innovation Group named DexCare, hence where I am today. And really, we, from the very first time that I met, I understood that this platform was different. And so as they began to tell us how we were going to create a digital front door, it was the first time I had heard that term, but it made sense, right? Every other industry, your Delta app, you leverage via online scheduling. You pick your airport, you pick your flight, you select your seat. It's all done within inside of the app. Starbucks, before this podcast, I placed my order. It's in my favorites. It's easy. And so that was the experience that we were able to then leverage for our health system inside of our health system app via the DexCare platform, bringing that access to the front door. And so over the course of 3 years working with DexCare, watching them spin out of the Providence Innovation Group, I realized that there was likely a place for a nurse at the table, that in order for DexCare to continue to have impact and have the impact that I saw it have with our patients, with our providers, and really with our capacity, I knew that I wanted to be a part of it. And I knew that staying inside of a health system would give me the ability to innovate with inside of one health system, but by making the jump to startup life, I would be able to have greater influence across the health system ecosphere. And so 2 years ago, this May will be the day that I made that jump, and really have launched into leaning into what it means to be a nurse in startup and health tech. And really have grown to step into my shoes as a nurse innovator as well.
I feel like we're going to arm wrestle on who gets to speak next, because I can see wheels turning for both of us. You go first.
Okay, well, I have a comment and then maybe a question. So my first comment is, wow, just connecting that dot of recognizing the power of your clinical experience, right? And your clinical knowledge and the knowledge that nurses carry, and translating that into one, the startup world, two, the health tech world, three, understanding that your power can grow as you transfer it from inside of walls to outside of walls, right? So that's my big comment, what I took away from what you were sharing, and just helping that other people kind of grasp that power, the power of nurse, right?
Mm-hmm.
So my question though is, when you mentioned the transitions through your nursing career, right? From nurse to nurse leader within the health system, supporting this project management. How did you work within the system? So we have a lot of people, and the majority of people that work within the system. How did you work within the system to accomplish, right? Because I think that's oftentimes where we find the biggest challenge is, like, maybe we don't get pushed, it doesn't move as fast as we'd like. But how did you find the how did you do that?
Absolutely. I think you're right. Just today, I was reading on LinkedIn a post about silos and the need to break down silos. And that resonated so deeply with me, not only for current state where I am today and the challenges that I still see from kind of the other side of the table, but also to my experience within the health system. So anytime that I was leading sort of these bigger system-wide initiatives, I really tried to focus on having a multidisciplinary team and really structuring a team that was different than myself. Having been a collegiate athlete, I think I bring a different perspective sometimes to healthcare of what a team looks like. And so I didn't assemble a team that was full of Emilys. I assembled a team that had, physical therapists, that incorporated our schedulers, that incorporated our medical assistants, our nurses, our physicians. And together we really would tackle the issues. Some of the projects outside of kind of this digital innovation, but really impactful around, enhanced recovery after surgery and being able to partner with our perioperative area and anesthesia to help really improve outcomes for our total joint patients. All of those initiatives were done with a multidisciplinary team, a team where everyone had a role to play, and that role was defined, and we knew what they could bring to the table to help us move it forward. And sometimes it's about having not only the people that are working on the project to be multidisciplinary, but having that executive buy-in that is cross-functional, especially within a health system, in order to truly move and transform care. It can't just be in one silo. It has to be, lined with a strategic plan. It needs to have executive level buy-in in multiple different streams. It can't just be innovation. It can't be operations. It really has to be a cohesive, collaborative effort.
Yeah. Oh man, I don't even know where to start. But I guess I'm going to choose, because you made the sports analogy.
Mm-hmm.
I am a sucker for anything sports, and the diversity in the building of the team is so critical. And what you just named, that we all have the same vision and we form the strategy together. I mean, that is the success. But something you said earlier, Delta, United, you can change your flight, pick your time, pick your seat. Oops, got to change my schedule. All of that is there. And I've always thought the same thing. I don't know if you remember this, but once upon a time, you'd have to call the radio station. Who sang that? What was that song, right? And you might hit record and hope you catch it right at the start.
Mm-hmm.
Or you call the store and you order the CD or the cassette tape, and it's like weeks till it comes back in.
Absolutely.
But now you just touch it on Shazam. It's downloaded on your phone. You own it in seconds. So why can't the hospital be that way? And it sounds like this is the kind of stuff we need to be doing. We haven't done it this way before, but oftentimes the biggest barrier to innovation is leadership.
Mm-hmm.
truthfully. And I get it because there's a million things coming at you. And like, when do I have time to think about this? Blows up the entire model.
Yep.
But I love that so it sounds like they were in your building and you dreamed bigger than beyond the walls. I talk to a lot of people. What do you aspire to? It's usually something within their walls. And I'm just curious, did you have to pitch your role? Because we're always saying, make your own seat. Were you the one that recognized the value of having a provider on the team and said, hey, it could look like this?
So it's interesting. It was definitely a collaborative effort. We had a, kind of quarterly check-in call with DexCare, and I left that call and, reached out to one of the executives at DexCare and said, hey, I think I could make an impact. I think this might be the next step in my journey. And she was like, that's crazy. Because we've been talking about this exactly. And, and it took a while, and it was a process, and it wasn't, kind of like the next day, right? It was definitely a process. And through that process, I really learned the power of advocating for yourself, to have the voice, to be able to showcase what I had done within one health system to drive change and innovation, and being able to, I don't want to say sell that, but show how that translated to a completely different realm, was, I think probably the biggest lesson that I learned. And it didn't just stop the day that I, joined the organization. It's been a transition and a transformation, and it's been, learning where to best leverage this nurse that's good at strategy and is great at building relationships and has the experience of being a customer. And so it's taken us, some time to really figure out where I have the most impact. How can we leverage that? And, I think one of the places where we've seen it, where I've been able to leverage and really help to drive change is really around helping health systems to think bigger and think outside of the box and think about the lessons from other industries, and how does that change and how does that help to inform the changes that we need to make within the health system. If we think about the Delta experience, right? That calling Delta at this point isn't going to result in any better result. In fact, it might add to your frustration. It's probably going to take you 3 times as long as if you just logged in and booked your flight and were on with your day. And I think that that's the experience that I am hopeful that we can deliver within the health systems, right? That the patient has a platform within their health system to search for care, search for conditions, search for fever, right? And be given the options that best fit for that patient, whether it's an urgent care, whether it's virtual care, whether it's, establishing with a primary care provider. It's having those options, and it's having those options without having to click through 7,000 screens or wait on hold for 30 minutes, right? In today's day and age, like, I just want it to be easy, and I want someone to help to guide me to what is the best fit care. One of the examples that I love to utilize about that kind of care navigation, if you will, that we help to enable at DexCare is one of our partners said, in the summers, we don't have a ton of volume in our retail walk-in clinics. And we were like, yeah, I can understand that, right? It's not cold and flu season.
Yeah.
And they were like, but our pediatricians' offices are overrun by sports physicals, by camp physicals, by school physicals. And so can you help us to drive that traffic to our quick care locations? And so through our search and through kind of the behind the scenes pieces, we're able to, if somebody searches for a sports physical, the only options that come up for them are their quick care locations. So we're helping to increase the capacity, unburden those pediatrician offices, and get patients seen that day and not having to wait days to be seen for care.
Yeah, I love this.
Okay, so I want to circle back to something you said really early on, and you were talking about when you were transitioning, and she asked about the position specifically and how you got there, and you talked about maybe it's not selling yourself, and I am all about how a nurse or a nurse leader brands themselves, right? Like you're a brand, you have something that you associate yourself with, that you're passionate about, and I think that's probably part of what happened with your work, right? In the health system, you were aligned as being an innovator. You were aligned as being progressive and taking on these projects and getting them steamrolling. And then when you saw another opportunity where there was a need for a nurse and leveraging that knowledge, it was building up that, okay, this is why you need this role. This is how I'm a good fit for that role. And I think there is something to unpack regarding like how we as nurses need to leverage our knowledge and advocate for ourselves and advocate for the position of the profession, right?
Mm-hmm.
So I just want to unpack. I think it's stellar that you were able to, put that together and figure out how you can leverage that impact to grow the impact of being a nurse. So I think I just wanted to connect that because I thought how impactful, like we really need to have those conversations more openly, like advocate for yourself, advocate for a role when you see the need for a nurse that really has that knowledge of connecting through the patient care system. Like that's where we need to be. We need to grow our profession in that manner to really leverage that collective voice. So I love that.
Yeah, I want to say, I hope our listeners take that away, because sometimes you see a job posted. This is great. Like creating your own and seeing a vision and making it happen is wonderful. But sometimes people just shut down with the job posting. I'm like, there are so many things that translate to what you offer. I always hired people that had played on sports teams or waited tables because not really only that, but that was a huge strength for me in them. So those same things translate. And I think sometimes we sell ourselves short of opportunities that we could truly make a difference. Because it sounds like, I mean, not only did you make a seat at the table, but you've aligned yourself with passion and purpose. You knew that you believed in this as something that could make a difference. And that's sadly rare, but can make all the difference. I mean, on the profession, on the patients. I mean, just think about the ease to navigate the system. Like, we don't know. You don't know if you're supposed to go to an urgent care I mean, I would love to see how does this impact emergency departments? How does it save time and money and getting people the right information? I have a fever, this, and this. Here's where you belong. How awesome.
Yeah, absolutely. And I think that, there is so many parts of nursing education, the nursing skill set, whether it's, motivational interviewing, it's therapeutic communication, it's nursing diagnosis. I think often one of my greatest tools is my nurse intuition, the ability to read a room, pick up on cues, understand what body language means. That is probably one of the tools that I utilize the most. And sometimes my coworkers will be like, no, I didn't get that vibe. I'm like, no, I got the vibe, guys. Like we need to make this change, or here's how I think the strategy needs to shift. And lo and behold, my record is pretty good about reading a room and figuring out what's the next right step. But as it comes to, even nursing innovation and strategy work, I think about, the nursing process as its own, right? And it's having a nursing diagnosis. It's thinking about the interventions. It's the reassessment. It's setting the goals. And, I think about that framework, and I think about how I leverage those kinds of tools every day. And it is, being able to identify the problem, think about the interventions, reassess, and not be afraid that if the first intervention didn't work, like that's why we reassess, so that we can do intervention number 2 or 3 or 4. And sometimes in order to reach that end goal, we've got to make shifts and changes. I think that was the best part of the pandemic for me, was no one was afraid of trying something different, because it was just like, we've got to figure this out, and we're figuring it out on the fly. And that fear of failure kind of went away for a while. And so it's how do we continue to bring those thought processes to the table as nurses to really drive innovation, drive transformation, drive strategy, drive change management. I think oftentimes as nurses, we are in a unique spot where we can sometimes get patients to do things that no one else can.
Yeah.
And that's a skill that comes to the table with me every single day.
Yeah. You said the fear of failure was removed. And my brain is challenging it. I'm thinking, well, I don't know what we're afraid of, because we're failing as we currently are. So we need to try something new. But the other thing was, man, as much as that time period was the worst, all the BS barriers were brought to a halt, and we were allowed to try something new.
Without the systematic requirement for approval.
Yes. It was literally, what are we going to do? Okay, let's try it. Oh, that didn't work. All right, on to what's your idea? And like the collaboration and teamwork, I think although it was stressful, it is some of my most favorite working memories.
Yeah.
Yeah, it was so stressful, but I agree. I think the opportunity to just say like, hey, we got to pivot today, and this is how we're going to do it. We're going to put a tent up outside and some IV poles, and we're going to take care of people, and it's going to happen. We're going to make it happen. But I agree. I mean, it was amazing to see how quickly we could respond when things were on fire, and how quickly you could be innovative and, come up with a plan and execute it in a matter of hours, sometimes even less. So
nobody was saying, hey, it's crazy to take care of patients in tents in a parking lot like you would in a normal meeting.
Yes.
They were like, okay, let's try it.
Yeah.
I'm like, can we just live like that every day, but without the pandemic part?
Yes. That would be dream state for healthcare.
Okay, Emily. So I have so enjoyed our conversation, and I'm so happy to welcome you to the Rule Breakers Club. But before we can do that, we have to know, if you're breaking any rule in healthcare, what rule are you breaking?
The phrase, I'm just a nurse. We
Yeah.
have to stop saying I'm just a nurse. We need to say I am a nurse, and here's what I have to offer. And we have to be willing to stand up for our profession and what we bring to the healthcare system.
Yes, I love that.
Okay, Emily Mike dropped it with that one. Might be my favorite rule so far.
Yep.
Okay, so if someone wanted to connect with you after hearing this podcast, what is the best platform for people to be able to do that, or where do you like for people to connect with you at?
I would love to connect with you on LinkedIn. Follow, connect, send a message. Always happy to have a conversation with a fellow healthcare rule breaker.
All right. Well, thank you so much for joining us on the Rule Breakers Club. We love a good rule breaker. Even though I know it's a little taboo, people think nurses always follow the rules, and we do. We tread the line, right?
Absolutely.
But we push the boundaries, so I love it. So thank you again for your time.
Absolutely. Yes. Thanks for having me.